Well, hello, everybody, and welcome. My name is Dr. Tahir Yunus, and I'm a laparoscopic bariatric and general surgeon at Evercare Hospital in Lahore, Pakistan.
And I am Dr. Arinze Mosanya. I'm a general laparoscopic and bariatric surgeon working at Evercare Hospital Lekki.
So, Evercare Hospital is a larger group and has branches in Pakistan, Nigeria, and in Kenya. And the benefit of that is that there is mutual collaboration between the healthcare providers in learning and as well as in patient care. So I've had the opportunity to come over to Lagos a couple times and work over here together with Dr. Arinze, providing surgeries to patients who needed them. And Arinze's come over to Lahore, and he's been as well experiencing the surgical atmosphere and the work environment in Evercare Hospital in Lahore. So Arinze, it's really nice to know you, man. I mean, we really had a nice
Yeah,
bonding together.
exactly. I mean, it started off with a phone call and a couple of video calls. And a few weeks later, you were here in Nigeria. We've got a fantastic collaboration since then.
Yeah.
And I really want to thank you very much and your team in Lahore for receiving me when I came over there. One of the best experiences I've had.
Oh, and we were so excited to have everybody over from Nigeria. I mean, it
Yeah,
was a wonderful experience in both ways.
excellent, interesting question. So for me, coming to Lahore was the first time to come to Asia. So initially, there were a lot of trepidation, not knowing what to expect, the different cultural mix. But I was pleasantly surprised by the warmth of the individuals there, and then the reception that I received by the co-workers in the hospital was fantastic. I never felt I was in a different environment, and I think that's the power of the Evercare platform. Even though I was in another country, it was similar to what I was used to in my own country, and the people were fantastic. I kind of enjoyed the working relationship, the dedication to DT, and the platform and similarity to the different quality programs and policies that we have in Evercare in Nigeria, in Lekki, Nigeria, were similar to the things I saw in Lahore.
Yeah, I mean, I totally agree with you. I had exactly the same experience as well. There was a lot of anxiety when I came over to Nigeria for the first time. It was a new experience,
Yeah.
a different culture, but all of that sort of faded away the moment I entered the hospital. So when I entered the hospital, I saw the same sort of environment that I was used to in Lahore,
Hmm.
and the welcoming, hospitality of everybody over here, the warmth. It made me feel at home.
Yeah,
Uh, and the very next day, we got started with surgeries. We
exactly.
did what? Now we did three surgeries in our first trip and another three
Three, so in
surgeries
a
in this
second
trip. So
trip,
we've done like six
six
bariatric
in
surgeries.
Nigeria.
Yeah.
And while in Lahore, we did quite a number too. We did about 12.
Right.
Yeah,
Yeah.
did
Yeah.
about 12 and a couple of other non-bariatric surgery, which also exposed me to a different concept of management of such individuals. I was particularly interested in how you were able to tackle a very difficult cholecystectomy, and funny enough, I had similar thing last week, and I was like, okay, how did Dr. Tahil do this? And that was a very good experience for us because
Right.
the
Right.
patient did very well. I went to him on the second day post-op. So such collaboration also improves patient outcome as we're able to learn from each other how to handle very difficult cases, which probably would have been more difficult if we did not have this
Right. Right.
collaboration.
I totally agree. And I mean, and what was interesting is that our nursing teams also got to communicate with each other and learn
Sure.
from each other.
Yeah.
And interestingly, we found that we all had similar problems and challenges that we were all facing. And we learned from each other's experiences on how to overcome those challenges and
Yeah.
those and how to provide better care to our patients.
Exactly. And it's actually translated to better working relationships down here in Nigeria because there were certain challenges that we felt were probably cultural, but when we came to Lahore, we saw that it's more of systemic. So we're able to collaborate notes and learn from you how you were able to address those challenges. And it has revolutionized our processes now. I mean, we have shorter waiting time, more OT efficiency, and better patient outcome. And that has been very instrumental to our processes down here.
Excellent, excellent. So, how did you experience the city? I mean, did you have an what
Well,
was your experience
I
of
was
the city
pleasantly
itself?
surprised because similar to what you see in the streets of Lagos, everyone was busy. Um, People were genuinely interested to know you, talk to you, get to know who you are, where you're from, take pictures with me and all that. So I felt like a little celebrity in Lahore. I thought it was a good experience. The weather was quite hot when I came. Average temperature was about 37 degrees.
Yeah.
But of course, the hospital was quite cool and chilled, and the hotel room were quite comfortable. Uh, I was pleasantly surprised with the amount of mangoes I saw on the roads. And I was told that it was about the mango season and there was a
Right,
mango
right.
festival just
Yeah.
before I came. Then I had the best meal of meat that I've ever had in a very long time.
That's
Thanks to
good.
Dr.
That's
Tahir,
great.
took us to this meat restaurant and it was an awesome experience, really.
Yeah. And my father was really glad to meet with you, and the
Yeah,
kids were so
exactly.
excited to meet
Yes,
with you
and I
when
had
you
an
came over to
amazing
their
time
home.
with your family.
Yeah.
Your dad, who coincidentally spent a lot of time in Africa, so it was like a walking encyclopedia of African geography. We talked about Southern Africa, Malawi, South Africa, Botswana, even Accra, Ghana, and Egypt. So it was a good time. I really, really enjoyed a good time. Your kids were wonderful.
Yeah, I feel the same way. I was impressed meeting your wife. She's a wonderful person uh, from a very learned family of physicians and established physician family. I really enjoyed the speedboat tour of
Of
Lekki's
the
waters.
Lekki
I
waters,
mean,
and
yeah,
well,
we
even got to the Apapa
right.
ports.
I mean,
Yes,
this is the first time I got so close up to a port and seen those ships.
ships. Yeah.
Those were
You
huge,
remember that they were
massive
offloading
ships.
some containers, and you could see all those giant magnets pulling up the
Right.
containers from huge ships. We even saw an oil vessel that was
Right,
discharging
right.
its cargo during the trip. Yeah.
And what I loved the most was that huge colada drink that you brought for me. I mean, I've never seen such a large drink in my life. That was really nice. The fish is great here.
Good.
The weather
So
is amazing.
yeah,
I mean, I really enjoyed the nice breeze while boating, and also during the ocean breeze is quite refreshing.
exactly,
My experience of Lekki and of Lagos, the trip has been great, and I always look forward to coming back here. I feel it's like a second home now.
exactly.
The operating room nurses, the teams, they're all so welcoming, and it was like when I came back, it was like, "Hey, where have you been? We've been waiting for you."
So I just want to get your opinion on how do you see this professional collaboration that Evercare Hospital has provided, where you, an accomplished bariatric surgeon,
Right.
and me, an upcoming, very, very motivated young surgeon who wants to provide these cutting-edge services
Right.
to
I mean, that's an
to
excellent
Nigerian
question.
populace. How do you see this, and
Yeah.
what has been your experience in trying to do this generational as well as professional transfer of knowledge and skills?
Right. That's an interesting question. And I've been involved in teaching and learning for quite a while, helped a lot of places set up their bariatric facilities and services, both in Saudi Arabia as well as in Pakistan as well. I mean, the services that we've set up in Evercare Hospital Lahore is also one of those examples where we started from scratch, and we've set up one of a world class sort of a places for bariatric and upper GI surgery. But I totally agree with you. What I felt is that the platform gives us an opportunity to not just work within the city and within the country, like what I've experienced in the past in both Saudi Arabia and in Pakistan when I was within the country and within the city, I was teaching and learning, but rather this is we're spanning across the globe, across continents, across cultures,
Countries, yeah.
and I think that's the power of the platform. I mean, the platform provided us this opportunity to meet up with each other, to collaborate, to learn, and share our experiences. And so I think this is a unique uh, platform that I've never experienced before, and it's an opportunity.
Yeah.
It's an opportunity to help each other. The platform has made sure that the challenges and the hurdles that we have in cross border teaching and learning can be overcome.
Exactly.
I mean, the logistics have been so much easier.
Yeah.
Had it not been for that ease of transfer, I don't think it would have been possible.
Exactly.
I mean, traveling all the way over to Nigeria, getting through the visa processes, the airports, the customs, immigration, coming over here, getting into a hotel, coming over to the hospital, making sure that equipment's all been prepared. I mean, these are huge challenges, and the platform took care of all of those challenges for us. So that, I think, is really the power of the platform that we're talking about. The Evercare Hospital Group has done an amazing job taking care of these challenges, so that two physicians can come together and then exchange knowledge,
Knowledge, yeah.
experience, and learn from each other, and not just the physicians, but
Exactly.
all
I was
healthcare
just about to
providers.
come
Yeah,
to that too, because you remember that when I came to Lahore, I came with the OT manager. I also came with the IPD nurse supervisor. And, there are very few organizations and hospitals that cascade that kind of learning to other support group. I
right,
mean, we could all be good surgeons, but if our team is not as good as ours, as we are, then we won't be successful. So that also underlies the reason why it's very important that your team is as good as you are. So
right,
that also has, revolutionized the concept of teamwork amongst the people we work with. So like in Evercare Hospital Lekki now, we've got a very robust bariatric surgery group, including OT nurses, physiotherapists, clinical psychologists, nutritionists, even the inventory and procurement, who have been collaborating with their colleagues in Lahore, such that such experiences and challenges that they've been able to overcome, we don't have to pass through that long process anymore. And we can then tap into their knowledge and their experiences and make our processes better. And it has translated, because so far we've done about 6 bariatric cases now, and it's 100% outcome. No complications, no downtime, no looking for materials and consumables to use. And it has also cascaded down to other surgeries that we do, because learning from these experiences help us to also address challenges peculiar to our environment when we manage patients.
right.
And ultimately, that leads to a
So,
better patient
where do you
outcome.
see this going, Arinze? I mean, this has really been a nice experience, and we've reached here. And how do you think this platform can help us leverage on these kind of opportunities, learning opportunities, and also financial opportunities, actually?
Yeah. So Nigeria is a large market. We've got about 200 million people here, and there are not many good healthcare facilities like the Evercare platform. I mean, we're still number one. So I only see growth and opportunities. With this platform and leveraging on the number of operating theaters that we have and the number of specialists, we can then provide more cutting edge services and surgeries to our patients. I see Evercare being the go-to place for bariatric surgeries and upper GI surgeries in Nigeria and even the West African sub-region. So it's only a matter of growing the capability of the team to handle volume, because this will definitely drive volume. As people get to trust the brand and trust the expertise of the surgeons, then we should also scale up to handle the crowd that will come later on. And I also see this cascading to other specialties. I mean, our other core specialties include cardiac surgery, orthopedics and spine, neurosciences and neurosurgery. And I see this successful collaboration between me and you cascading to other specialties in the platform,
Yeah.
making this place the one-stop place for surgical and medical treatment within the sub-region.
Yeah.
Yeah.
And my own perspective is that both Pakistan and Nigeria are countries that we face a number of challenges in providing world-class healthcare to our patients, and because of the challenges that we share, using the platform, we can learn from each other, collaborate, and overcome those challenges. And sometimes, the motto of Evercare is transforming healthcare.
Yeah.
We do know from the hospitals in our vicinities, in our regions, that the way they're applying international standards, we can do a better job. We can do a better job, and patients do feel that
Yeah.
when they experience the care that they're getting at these kind of facilities, where you have those international standards in place, safety regulations in place. Patients do feel the difference in the quality of the care being provided, and that actually translates to better healthcare and mm, better patient satisfaction at the end of the day.
Yeah.
So our mutual collaboration from this platform can expand to improving quality, driving quality improvement efforts, uh, collaborating in collecting data, and
Yeah,
using that data to make us better providers.
exactly. And there's also the importance of training, and the platform will also leverage on give us leverage as we plan to institute some residency training in certain specialties, especially in Evercare Hospital Lekki. I see an opportunity for younger surgeons and even medical students who hitherto have not had exposure to some of these cutting edge procedures and specialties, being encouraged to, you know, probably explore opportunities of being future specialists and surgeons in this field. So the opportunities and the ramifications are just too enormous for us, and I can't
Right,
wait.
I think you're
I
right.
can't
This
wait
is
for the
just the
things to
tip of the iceberg that we're
exactly.
just,
I can't wait for the things that
we're
are gonna
just
come out from here.
scratching the surface here,
Sure.
and there's a lot more to come. Well, really, I mean, I thank you, Arinze, for the excellent hospitality and the wonderful experience that I've had. And I look forward to coming back again. And I'm looking forward to
But
you coming over to Lahore as well next time.
definitely. And this time around, I'll get prepared, you know, and
All right.
explore it
Well,
out.
thank you so
And
much.
then I'll hold you on to travel to the up country. I heard there are a lot of glaciers and
Yeah, yeah, we've got
and
some trips
mountainous
planned
area.
out for you.
Yeah, sure.
All right.
Thank you
Well,
very
thank you
much.
very much. And thanks
And
for
thanks for
joining
having
us.
us. Bye bye.